So critical periods and teratogens. So what is a teratogen? It is anything that can cause or increase the chance of a birth defect. Anything. Something the mother's exposed to during pregnancy is typical. So it could be a prescribed medication, like if someone's on an antidepressant. It could, of course, be street drugs and alcohol. We know well about those. Tobacco. It could be exposure to chemicals or radiation, like if she works at some sort of a job that could cause her to be exposed to dangerous things like that. And it could also be a sickness, an infection of some sort, a viral infection. And so let's look at a few of these and talk about, first of all, critical periods. So this seems like a complicated chart, so I want to orient you to it a little bit. So first off, what we have here is the entirety of the pregnancy, okay, until birth. We have it organized, like I showed you before, into the germinal period, these first 2 weeks, the embryonic period, the second 8 weeks, and then the entire fetal period, right? So time-wise, it's a lot longer, this fetal period. But because so much is happening during this embryonic period, they've expanded that. So what do we have going on? So first off, something goes wrong in the germinal period, it's likely to die, prenatal death. Woman wouldn't know she's pregnant, probably. If something happens during the embryonic period, look what it says here, major congenital anomalies, something seriously wrong, and that's what the red indicates. The yellow indicates functional defects, so something's not working quite right, and minor congenital anomalies, not so serious. But the serious ones are taking place during this embryonic period. So what's developing? Look at here, major anomalies if something happens during the first 16 weeks. This is brain and central nervous system. Remember what's happening. Those neurons are migrating and differentiating. If there's a continuous exposure of this mother to something harmful, to a teratogen, brain development is likely and serious brain problems. Less serious after 16 weeks. Less serious. Maybe something like ADHD or a learning disability that doesn't appear, you know, that you're not aware of until the child's in 2nd grade, right? Or difficulty with some sort of emotional control. The heart, you can see development taking place here. Serious anomalies if the woman is exposed to a teratogen. Upper limbs and lower limbs, and lower limbs developing during this time. Eye development here. Maybe you noticed, and all the way till the end for eye development, maybe you've noticed that babies born prematurely, those children often wear glasses. That's because the eyes weren't fully developed when the baby was born. You can see when the teeth are developing, the palate. Maybe you know someone who has a cleft palate where upper roof of the mouth doesn't close properly or closes only partially, often needing surgery. The genitals. That's that section, that what I discussed with you before. Ear developing here. So these are the critical periods. And what's the consequence? This is the very same thing. It's just outlining describing the consequences more. So if we have brain exposure during the first 16 weeks, we have exposure to a teratogen, this could result in something serious like mental retardation, like very serious inability of the brain to develop. Something happens here with the heart early in these first 6 weeks, we might have holes in the heart, like, you know, this child might really struggle. This cleft lip is occurring here. See if there's anything else. Masculinization of the female genitalia. Again, that's if something is happening with respect to the anomalies in the sex hormones. This image here is coming up right now, I think. And it's thalidomide, and I had a video I wanted to show you, but I can't. So thalidomide was a medication that was prescribed in the 1950s for women for morning sickness and sleep problems. So a morning sickness is nausea and or vomiting that a woman feels early in pregnancy. as her hormones begin to change. And this was given to many women as a treatment for that. So women trusted their doctors. But unfortunately, thalidomide was a teratogen unbeknownst to the prescribers or the mothers, and it affected limb development, arms and legs. So you can see when a woman would be taking it, going back to this one, you can see the limbs are developing here, 4 to 6 weeks. That's exactly when a woman might be feeling a lot of nausea. So the teratogen directly impacted the limbs. And in this country, the drug never got through. The video that I was going to show you was about the doctor who worked for the FDA, Federal Drug Administration, Food and Drug Administration. And she declined it. She said the tests weren't good enough and she wouldn't let it be released in this country, but it was released in Europe. And so we have a lot of thalidomide babies born with these foreshortened limbs or foreshortened legs. So both can happen. And you can see it in this infant. That's an example of a teratogen of the worst kind. That drug is still available today for, I don't even know what purpose, but you can see it's got a thing right on it. Don't take it if you're pregnant. Tobacco. Why is tobacco a problem? The main problem is the reduced blood flow to the fetus. So as you fill up your lungs with smoke instead of with oxygen, then your blood is carrying less oxygen through your body, and that reduces also what's being carried to the baby. Fewer nutrients. So here are the consequences of that. We could have low birth weight. You might think that's not a big deal. I have a question about this, so I'll clarify in case we don't get to it. Usually less than 5.5 pounds. So low birth weight does not mean a small baby. It means a baby that's smaller than 90% of the babies who are born. And low birth weight can have long-term, lifelong consequences in terms of muscle strength, in terms of lifespan, in terms of other functions. We'll see if I get to it in the slide. I know there's a quiz question on it. Can lead to premature birth. So first off, if this baby isn't getting nutrients, obviously it's not going to be able to grow enough. And even if it's full term, the woman carries the pregnancy all the way to 40 weeks, she can still have a low birth weight baby because of smoking. Premature birth, born before 38 weeks gestation. Also a problem, maybe the eyes aren't fully developed, maybe the lungs. Miscarriage, double the risk of miscarriage for a mother who smokes regularly. Placental problems, we already talked about those. And sudden infant death syndrome, which is where the baby is just put down to sleep, and when the parents get up in the morning, the baby has stopped breathing. And so for a woman who's a smoker, you know, our tobacco companies have made this an addictive substance for us. Not the respectful way that Native people use tobacco, right? But more, sell as many as we can so people become addicted. And so ideally, a woman should quit. Work very hard at that. And if she's not able to, she's got to get away from it as much as possible. If there's someone in her home who smokes, that secondhand smoke, she needs to avoid it. That person needs to go outside and she needs to do all she can to reduce and quit. And interesting, smokeless tobacco isn't going to do it. It's also associated with low birth weight and prematurity. You've probably heard of fetal alcohol syndrome. Fetal alcohol syndrome occurs with heavy drinkers. Children who have fetal alcohol syndrome have these certain characteristics because it affects many aspects of development. For example, you won't see this philtrum or this groove that we tend to have right here. A child whose mother really drank a lot, it'll be flat right there. In fact, the whole face will be kind of flat. The upper lip will be really thin. So certain characteristics like this, but of course the most serious characteristic is mental retardation and trouble with emotional control. It's recommended to have no drinks because even moderate drinkers, when they study the babies afterwards, the babies tend to be less attentive and alert even as late as 4 years later. That's for moderate drinking during pregnancy, 1 to 3 drinks a day. And there's also a higher risk of fructular teratogens. I'm not going to cover this, even though it's important, but the evidence on this isn't in yet. I haven't been able to find any sound studies of what happens. Prescription drugs. When we study medications that are going to be prescribed, we do not include pregnant women in those trials. We couldn't. Because what if we discover that something goes wrong? We cannot expose intentionally an infant to something that could potentially harm them through the pregnancy. So they're not part of the trial. So then we're not sure, right? So how can we find out if a prescription is harmful during pregnancy? We know the ill effects of depression on infant development and prenatal development. What if a woman is taking medication for depression? Then the doctors have to weigh out which is going to be more harmful, the depression or the medication. It's tough. So SSRIs, so the way they study it is they look at women like this who need to have that medication or they're not going to make it, and then they study the infants afterwards. That's the best they can do if someone needs a medication. But there are some risks. The neural tube might not close. Anencephaly means the cephalus doesn't develop. There's no burning. Heart defects. The risk is greater during the embryonic stage. So if the woman can stay off it during that stage, the harm would be reduced. Of course, we know about meth, the DNA damage at the chromosomal level. The infant growth retardation means that the growth doesn't happen well. There's restricted growth, heart defects, usually premature birth, and even lifelong challenges. Infants can be born addicted, as you read about in your book, right? So if the mother is addicted, that infant can be addicted. And you also would have read about a controversy of whether the law should intervene with a woman who's addicted. Kind of saying, does that woman have the right to harm that unborn baby through her own addiction? And this is like sort of a question that we could wrestle with. We had a lot of time. Infections can be teratogens, you wouldn't think, right? They were worried about COVID for a while, weren't they? COVID harmed a baby. A really bad one is this rubella, German measles. It's not that serious if someone gets it. You know, they sore throat and flu, that sort of thing, but its impact on a developing fetus are severe. So if she's exposed before 20 weeks gestation, she can miscarry, lose the baby, or that child can be born with defects in eyes, ears, heart, and brain. So it's serious illness. So now we vaccinate. All of you probably had to have vaccinations before they let you in school. Even in college, sometimes you have to show your vaccinations, but lately there's become protests against these vaccinations, worries about them. Now we have cases of polio emerging in Gaza, for example. Polio, something that we're vaccinated for all the time that causes death, or like, you know, President Franklin Roosevelt had polio and he could never walk. He's in a wheelchair. These things come back. There are measles outbreaks now in schools from people who don't want to immunize, and boy, the consequences are severe if someone is pregnant. An interesting one mentioned in your book is toxoplasmosis. It's a parasite that can lead to, again, some serious conditions. We might be exposed to it all the time and not suffer any consequences. Our immune system helps us, but a developing embryo fetus could actually die, and a newborn can be affected as well, although most aren't. And so women are always encouraged to avoid raw meat. That's where we might get the parasite, or even the utensils touching them. Wash your fruit and vegetables, and don't clean the kitty litter. Don't dig around in the dirt or sand. You might pick up those parasites. Okay, let's see here. When my daughter was pregnant, they had gone to Ecuador a few weeks, a couple months before she got pregnant. And at that time, there was a virus called Zika virus spread by mosquitoes in 2015. doesn't create symptoms much in adults, but it has really serious consequences for developing babies. And encephaly, again, that non-development of a brain. And she actually, when she was staying with me for a little visit out in North Dakota, she actually got a positive Zika test. And she was just terrified, nightmares. And then they sent the result on to CDC and it came back negative, like scary stuff. Lead poisoning we talked about. Lead can be found in all these places in your home. Lead paint if it's older. A toy got from, it used to be maybe China or someplace abroad where they don't regulate lead. Solder on something like your trash can. You might have lead in your water like the Flint, Michigan that I told you about. So it can come in a lot. And of course, airborne, we used to have lead in our gasoline, so people who live near interstates were exposed. And it can lead to really serious consequences. Mental retardation, ADHD, cancer, worse for children. About radiation a little bit, it can harm the gametes and have serious consequences. I have a nice little video on this. I'll post it in case you're interested. How about uranium? Uranium is an environmental teratogen that's around here. Depleted uranium is what they are not using anymore, kind of the waste from it. And it can saturate down into the water. It crosses the placenta. It can cause early deaths and birth defects and increased risk of preterm birth. And it can harm neural tube and neural development. This is an older study from the 1970s, but 26% of Navajo women had uranium levels in their urine that were higher than the top 5% of the US population. And some of those were found in their babies as well. And in the Shiprock area, again, this 1970s work, there was evidence of spontaneous abortion and congenital malformation at higher rates than should have been. What do you do about it? Well, don't drink that unregulated water. Drink water that comes from a clean place, either bottled water or water that's being tested. Be careful that way. I know Perry Charlie, who used to be a faculty here, was looking at uranium in the cattle around those mines. Is it coming through the meat? I think water is probably the biggest risk. Be cautious. Mercury can come through. We don't put mercury in thermometers and things like that anymore, but it can come through fish, especially bottom feeders like carp. Pesticides, oh my gosh. They spray around the dorms we're staying in, right? They stay around the Hogan housing. I don't want to be anywhere near that spray personally, and I'm not about to have any children in this lifetime anymore. I still don't want to breathe that in.
I think another thing was like, I remember how some people's grandparents were in Vietnam, and the whole Agent Orange and how it affected future generations. Oh my gosh, yeah, Agent Orange, they would spray it on the jungle and it would just kill all the trees. Like, yeah, my late grandpa, he was a Vietnam veteran, and from that he got like all kinds of health related issues. And my mom was telling me, like, if you have kids, you might have a chance to pass something on like that too. Wow, I did not know. I guess I never looked at, but I wasn't aware of Agent Orange as a teratogen, but it would not surprise me one bit. I'm glad you shared that. And then it also makes me wonder whether there's epigenetic change as a consequence as well. That's being passed on. Herbicides. I used to, when I was in North Dakota, a source of a lot of our grain in this country, I rode horses for one summer. I'm not skillful, but I knew a little bit. And we would come to these fields, and the person I was riding with would say, don't take the horses in there. It was a completely field empty of everything. And I'd say, why? And he'd say, well, they just sprayed it. We don't want to get the horses in that stuff. But I was thinking, do we want to be eating that stuff?
Like from then on, I really didn't buy wheat that wasn't organic personally, because I don't know. I know they measure the half-life, but in science, we can only know about the things, we can only get answers to the question we ask. And if they're only asking about half-life, what are they missing? Anyhow, they can certainly cause harm to developing embryos. And then you've probably heard of BPA. It's in plastics, food beverage containers. A lot of the plastics, if you have any plastic right now, like that water bottle that you have, Caitlin, it probably might say BPA free, because BPAs are linked to a variety of birth defects. So you want to be aware of that. And if you have one of those styrofoam food containers and you're going to reheat your food, well, don't reheat it in that styrofoam food container, because if there are BPAs in it, they're going to leak out into your food through the process of being heated. So, and this is really a big deal these days. A lot of people are getting companies to stop. Is it BPA free?
I don't see any.
Oh, no.
Don't forget mine.
Is yours?
Oh, wow.
Is yours BPA free? Usually it says somewhere if it's BPA free. I bet Starbucks would be BPA free. Okay, this is a little video I was going to show you about radiation in the Chernobyl nuclear accident. Shows what happens in the brain, some things not to worry about, and the 4 principles we think about. First, the embryonic period is when the developing baby is most vulnerable. Serious defects during that first 8 weeks, well, week 2 through week 8. Secondly, all throughout the pregnancy, teratgens can affect the developing brain. Later in pregnancy, they might be more subtle effects, learning disabilities, behavioral problems. Thirdly, there's a dose-response relationship. The more the baby's exposed, the greater the damages. Finally, well, not finally, there's one more after this. We don't know the threshold, and genetics might play a role. And finally, teratogens may influence long after exposure, like I mentioned to you. You wouldn't know about ADHD or learning disability until the child's 7. All right, so that's what we have today. I'm going to try and adjust our reading a little, because I actually think it's important to cover these maternal factors, premature birth and low birth weight babies. So we'll cover that next time, and I'll double check the quiz to make sure there's no question on there that we haven't adequately. So I'll modify a question if I see one on there. Other than that, you guys do your reading before class. It's the first part of chapter 3. You'll see that one for you. And then we take your quiz from chapter 2A, because you have a second attempt, all of you. And then finish your work by Tuesday noon. Or midnight is when it's going to close, unless you contact me and let me know that you have a deadline. Everyone, thank you for being here. Forward to seeing you next week.
Thank you. Good night.
Good night, everyone.
Night, guys.
Ms. Ross,
Yep.
I have a question. When you say chapter 3, is that going on to, are we still in the section 2? Or is that?
We did not cover, your book has only a tiny little bit about premature birth and low birth weight. We're going to cover it a little more in depth than that.
Okay.
But regardless, your reading is in chapter 3A, and it's listed at the end of the unit.
Okay.
So you'll see it there. It says prepare for next week, and you'll see what sections in there. It's also in the syllabus.
Okay, that would be the infancy and toddlerhood?
Yeah.
Okay. Okay, I'm just
yeah, just to read the first part of that chapter, because we're going to cover it a little more slowly than we do. Here it says 3.1, 3.7.
okay, all right. It's just the way I printed my